Hi, I'm Sydney.
And I'm Kathleen.
And we're OT students at Augusta University, and we're just going to be talking a little bit about what OT is and how we can use it to help our friends with ALS. So occupational therapy is all about getting people back to doing what they want to do and what they need to do in their everyday lives, and we serve everyone across the lifespan, all kinds of diagnoses, and we specifically address areas such as dressing and bathing, or even sexuality and spirituality. These are what we call ADLs. ADLs stands for Activities of Daily Living, and these are everyday tasks that people complete in life to do what they need to do and get back to doing what they want to do. And today we're specifically going to talk about bed mobility.
So as Sydney said, as occupational therapists, we really seek to promote the independence for our patients, PALS, patients with ALS. So we want to work alongside our patients. We don't want to have them do it individually and us just watch. This is really a team building process. So today we're going to start talking about independence, quality of life, and also decreasing that caregiver burden. So unfortunately, ALS is a degenerative disease, and it's really important for our caregivers to stay engaged and along the process while also promoting independence for our family and our who we're taking care of, but also to ensure safety and reduce that burden for themselves. So it's really important for bed mobility to have these techniques that increase our independence, maintain our independence, but also ensure safety. So today with bed mobility, we're really gonna look at the techniques that we're gonna talk about later on with y'all.
Hi, I'm Jazzy.
I'm Lizzie.
And now we're going to be talking about techniques that make ADLs easier, specifically bed mobility. So the first technique is going to be a compensatory technique. And this is just an alternative way to get a task done. So this could be things such as switching out shoelaces for Velcro to make putting on your shoes easier, or even switching out silk sheets for cotton sheets in order for an individual to get out of bed easier and get back into bed easier as well. Another example would be work simplification techniques. And these could be things such as planning out your stretches before getting out of bed to make that task easier for the individual.
And another technique that we can implement are energy conservation techniques. And this simply means integrating breaks during the task, or simply breaking down the task so that it's easier for an individual to complete the task depending upon their energy levels. And the focus of that is to really decrease their fatigue. And another technique we can use is actually using adaptive equipment, such as using bed rails, an incline pillow, or the use of silky sheets with an individual. And basically, adaptive equipment helps increase independence, overall quality of life, and increased engagement.
Hey, my name is Emily.
I'm Samari.
And today we're going to be demonstrating and showing you some of these bed mobility techniques for patients with ALS. Samari is going to be my patient today, and I'm going to act as the therapist or caregiver in a situation. So we are going to start with more independence with just me coaching Samari through these bed movements, and then we will transition into teaching techniques for a more dependent patient with ALS, for caregiver safety, and techniques for them in the bed as the disease has progressed further. And then I will show and demonstrate the use of some adaptive equipment as well. All right, so we're going to start with a ALS patient who is a little earlier in the disease progress, who is more independent, and I'm just going to coach them through some techniques and safety techniques as we go. So first, Samari is a little far over to roll and sit up on the edge of the bed. So what I'm going to have her do is I'm going to teach her a technique to shift her body over on her own. So what I'm first going to have you do, Samari, is just bend your knees up and place those feet flat on the bed for me. Perfect. And then what we're going to do is, using your feet and your shoulders, I'm going to have you lift your hips straight up, shift them over towards me, and then follow that shift with a shoulder shift. Does that make sense? Okay, so raise those hips, bring them over towards me, and now follow the shoulders. Can you do that one more time for me? Up with the hips, awesome, and over with the shoulders. Perfect. And then she's gonna roll over. So what I'm going to have her do is kind of tuck her right arm across so as she rolls it doesn't get stuck or squished under her. Then I'm going to have her use her left hand, reach over to this side of her and place it on the bed as she drops her knees, and her whole body is going to roll at the same time. Perfect. I'm also going to go ahead and show you what that might look like with a bed rail. So Samari, if you will roll back over. If you have access to bed rails, these are also good and improve independence when rolling. So you do the same thing, cross that right arm across so it doesn't get squished, drop those knees, and as your knees drop, reach over with your left hand, grab that rail, and pull yourself over. Awesome. And now I'm going to have you sit up. So what I'm going to have you do to sit up is place this hand on the bed so you can push up just a little bit. I'm going to have you swing those legs off the bed, and as you swing your legs off, push through that hand to sit yourself up. So swing those legs. Awesome. And now we have them sitting edge of bed. As a caregiver, it might also be good to provide some standby assistance or some contact guard assistance just for safety as they're moving independently. So that just means standing close to them, keeping a hand on them as they move to increase their safety in the bed. Okay, so now we are going to demonstrate what it might look like if a patient was more dependent. For me, I'm going to show techniques that improve safety and movement of the patient with ALS, but also for caregivers. Moving a dependent patient can be dangerous for you and on your back, and as a caregiver, you want to be able to continue providing that care that they need, and if you are hurt, that's not going to happen. So I'm going to show a roll and a sit to the edge of the bed, what that would look like from the caregiver's point of view. So first, you would want to raise those legs up, just like I had her do independently, with those feet flat on the bed. If they can get their feet flat on the bed and keep their legs here, great. If not, another technique is to keep this leg flat on the bed and cross this leg over. So it'll help with momentum as I roll her. Then I'm gonna just tuck her arms in so they don't get stuck under her. I'm gonna use her shoulders and her hip to roll her. These are called key points of control. These are going to allow me stability and her stability as I move her. So I'm gonna come here, roll her to the edge, and then I'm gonna keep my hand on her because she is dependent, but I'm gonna use this hand and swing those legs off of the bed, and then I'm gonna use both hands on her shoulders to lift her up to the side. One device we're going to talk about helps the sheet kind of lift off the patient just a little bit. If there's less of the sheet on it, it might be easier for them to move around in the bed. You can order this device online, and you just tuck it under the mattress, and then you would just make the flat sheet over this device. So I'm going to show you just using something simple as a pillow. So kind of just set the pillow in there, and then you would bring the sheet over and kind of tuck it in. You would want to tuck it into the mattress so that it would stay, but it just kind of lifts the sheet off the patient just a little bit to improve bed mobility and independence in the bed. Second is an incline pillow. An incline pillow can help with comfort, with breathing, and with independence in the bed. If they're a little bit higher, they don't have as far to move when they need or want to sit up. So, for an incline pillow, you can have the patient sit up. You can place the incline pillow and lower them back. Just their head is just a little more raised if you don't have a bed that is adjustable. Another piece of adaptive equipment that we're going to demonstrate today is a draw sheet. With a draw sheet, you can get it under the patient. It can be used to move a patient around in the bed and assist you as you're getting them to roll and sit up. So first, what you're going to want to do is you're going to take the draw sheet and you're just going to roll it up about halfway. This is going to make it easier to get under the client and on their other side. So then you're going to line it up on the bed. what I'm going to do is I'm going to roll Samari away from me so I can get the draw sheet up under her. So I crossed her legs. I'm going to use my key points of control and roll her. I'm going to get the rolled up part and kind of get it under her as much as I can. I'm going to roll her back towards me. I'm going to move this foot because now I'm going to roll her towards me so I can unroll the rest of that draw sheet on the other part of the bed. And roll her back. Then once you have the draw sheet placed, you can use it to help you roll the patient. If you wrap it kind of around them, get their foot placed correctly, and roll them to the edge of the bed. You can also use it to help you get them to sit up, grabbing the bottom piece, swinging their legs off, and then pulling the sheet to sit them up. This protects you and your back as a caregiver. It also makes the patient feel secure because they're kind of wrapped. Last demonstration with the draw sheet. You do need 2 people, so I have Kathleen here to help me. But if you do walk into the room where the PALS is and you see that they're kind of shifted towards the bottom of the bed and you want to get them back up to the top of the bed where it's more comfortable, this is a technique that you can use with the draw sheet to just help them shift back up to the top of the bed. So we have the draw sheet placed under Samari already. Me and Kathleen are going to grab the draw sheet as close to her body as we can after we position her hands across her chest to keep them out of the way. We're going to grab the draw sheet as close to her as we can. We're going to communicate about when we're going to move. So we're going to move 1, 2, 3, go.
Okay.
You want to go ahead and shift your weight towards the top of the bed to help with momentum when you move. All right, are you ready? 1, 2, 3, go. And then the patient is back to the top of the bed, more comfortable and more safe.
Thank you for watching. We really hope that you found this information helpful.